Lord. All right, let me make sure everything is good, my settings and everything, and then I will get into this live. Let's see. Okay, it says waiting for me, but I'm live, so maybe this will work. There we go. Okay, so let me reposition some stuff. Okay, so I want to get into, let me mute this so I'm not echoing. Hello, everyone. I wanted to get into the misconceptions of travel nursing, and especially travel nursing in 2024. A lot of people, they have mentioned, and while I'm talking, I'm just looking at my laptop so that I can get into the chat and see if you guys are saying anything. But a lot of people talk in my videos, the one video where the travel nurse is at a long-term care facility and she was complaining because they're short-staffed. People were saying, oh, well, you make $100 an hour or you make $5,000 a week. That is not true anymore, not for 2024. In the height of the pandemic, yes, but in 2024, absolutely not. Unless there's a strike contract, and in strike contracts, you are getting a good amount of money for like 10 days, unless they extend it. So while we're talking today, if anybody has any comments they want to put in the chat about nursing, travel nursing, or in general about my channel, please do. But I wanted to clear the air because there's a lot of people that think about, travel nursing as being this wonderful job that you get into and you get paid top dollar and you work 3 months and then you out. So the process of, and while I have about 40 people watching, can I get some likes, some thumbs up? So I appreciate those. And if you want to say anything in the comment, even a hi, let me know. So when you get into travel nursing, because I started travel nursing back in 2021, there's a process. So you're not getting in as like you would work a regular job. You apply, you go through the interview process, and you get hired. No, it's not like that for travel nursing. When you get into travel nursing, because it's a lot of student nurses that are in school that want to become a travel nurse when they get experience, I'm telling you now, what you have to do is a process. So when you apply for these agencies, and you don't want to apply for just one, you want to apply for at least 5 when you're doing this, because every agency is different. When you're applying for these 5 agencies, you have to be compliant with all 5, right? So you look at what they're offering. You're enticed by the weekly rate, so you apply with them. So they want you to have referrals. They want you to have not referrals. I'm sorry. They want you to have what is it? You want to have. Let me thank you for your videos. Oh, no problem, Dragonfly. Man, these. I'm looking real bloated right now, y'all. I don't feel cute, but anyway. um, so with yes, references with travel nurses, with these agencies, you have to have at least 2 to 3 references per agency. I mean, you can use the same ones, but the people may get frustrated because they're continuing to answer all these questions for different places. But if they're travel nurses, they understand. They don't care. You have to have, of course, your resume needs to be updated. That's no biggie, right? But you need to format your resume. If you've been traveling already, you need to format what you're doing every 3 months. And some places want to know what you're doing in between. If you took maybe the summer off, they want to know, what were you doing? Were you looking for work? Were you, out on a sick leave, medical leave, something like that? But not so much But still, when you doing your resume, you put in each individual place, whatever agency you have, so that they know where you work. When it comes to testing, a lot of people don't tell you about testing. Now, let me see why is ours so much pickier about HR pickier about travel nurses. I don't know, Dragonfly, why HR is much pickier. Um, I mean, they need the help. So as long as you're compliant and you have all of your testing done, which I'm gonna get into, then they should just let you in, unless you've worked for that place before and you quit to travel. That's when they kind of get a little like, I don't know about this type deal, because I quit a job that I had because I felt like I wasn't treated fairly. And, I was there longer than the other young lady that was there. And she was like working from home, and I had to come into the office, and I didn't get it, but it's okay. I ended up leaving and getting the bag. And, as a result of that, my boss got upset and decided to put me on a do not hire list. But that's not the only hospital in Michigan that you can work for. And I had an interview with them after the fact, and they still were going to hire me. So, I guess that it depends on the place. So, when you're doing travel nursing, each agency that you're with, you have to do a test. You have to do multiple tests. So, for me, let's say I wanted to do a clinic job, or I wanted to do case management. I would have, there will be a nursing case manage I'm sorry, yeah, a nursing case management time test. Usually it's in Relias. But the agency will have you to log in, and then it's time. So these tests range from 30 minutes to, I think, an hour. They have core mandatory nurse 1, 2, and 3. And if you're watching this and you haven't been in travel nursing, write this down. If you think about doing travel nursing in the future, write this down. When you're studying for those time tests, make sure that you are in a quiet environment. Like right now, I have a 6-year-old. I have older kids, but I have a little one. So when I was taking my test, she either was in school, or it was the weekend and she was taking a nap, or she was watching a movie, and she didn't bother me, because you can get distracted with the kids around, and then remember you're on a time test. So no, you can't go make a snack. No, you can't go outside and play for a little bit. You're on a time test. So once that time runs out, they can reset it for you to take it again, but it just doesn't look good. And you are only given 3 times. So say you take the first test and you pass it. Perfect. I think you have to have at least 70%. Some of them are at least 80%. But if you take these tests and you fail them, I'm going to give you somewhere you need to look up and study. So, and my old channel that I had before was hacked. It had all of this information, and now it's all gone. So hopefully this will reach whoever needs it. So if you are studying for these multiple tests, the core nursing 1, 2, and 3, whatever primary care or case management or med surge, sometimes there are little study sheets, and depending on what the agency uses, they have little study guides that's $10. They didn't have any for me when I did case management, but they had them for like med surge or labor and delivery. But what you need to do is go to Quizlet. Okay? Quizlet. I'll put it in the chat, because Quizlet is free. And what you do is you go on Quizlet, and when you are looking at how to study, say you're doing core nursing 1, core mandatory, I think it's core nursing mandatory part 1. You put that in Google, or if you're on your cell phone, you put it in your Safari, and you submit it, right? And then you'll see Quizlet. You click on that, because Quizlet is free. What you do is you look at the flashcards and kind of go through the flashcards. Some of those questions are verbatim the answer to the questions for core mandatory 1, 2, and 3. Okay? So that's a little, as people will say, a little nugget right there. If you get into travel nursing and you don't know how to study for those tests. Now, before you even go through the process of getting to the test, you apply, you you have your resume, you reach out to the recruiter. Everything goes like this because it's a lot of people that quit travel. I mean, it's a lot of people that quit staff to be travel. So it may not be the best contracts out here right now, but when they see something that's maybe closer to home, or it's a better rate of pay, or they're just getting out of a contract and they want something else and they see it, best believe these travel nurses are going to jump on it. Of course, it's not going to be 5,000, 10,000 a month. Those are gone. I mean, I'm sorry, 5,000 or 10,000 a week. Those are gone. But when they see a 3,000 or a $2,800 contract or a $3,600 contract for a week per week, they're getting on it. So you want to make sure that's why I say 5 places, because you want to make sure you're lined up with multiple, because each agency is going to have different jobs. And some of them will have the same, but some agencies will pay more than the other. Prime example, if you look at the in the description at the very bottom, there's the Vivian app. The Vivian is free. I tell people about it all the time. I use it as a resource. I don't necessarily apply for jobs on there, because by the time the recruiter gets back to you, the job is done. I mean, the job is gone. So you use it as a resource, and thank you so much. You use it as a resource, and when you're done with looking to see how much the prices are, you go to that agency. If you're already signed up with the agency, reach to the recruiter directly and say, hey, I want to be submitted for this. Because when you're on an app and you're not already signed up with them, it takes time for you to get everything set up. And when you're getting everything set up, somebody else is already set up with them. And guess what? You missing out on a $3,000 a week contract because you weren't already set up. So it seems like I keep saying set up, but anyway, no problem. I'm trying to help. It's a lot of people that gatekeep and things like this, and it's a lot of travel nurses that say, "Oh yeah, reach out to my recruiter." Be careful with that, unless they're telling you what you need to do, because for me, I would give people my recruiter, especially if you were based like case management based, because I have a recruiter that's specifically with case managers and social workers, nobody else. And then I have other recruiters that work with everybody, right? So I tell them, hey, if you need a recruiter, let me know. I'll give you his information. And what the plus about sharing your recruiter is, if the person signs up for the job after they've done with a full assignment, then the person that referred, prime example, me, I would get a referral bonus. I don't even think I even cared about it, because back then when I was giving the referrals, I mean, I was making up $3,000-$4,000 a week, so it didn't bother me. I just wanted to share the information, and then everybody's not going to sign up right away. And it's okay, because I did my research. So what I do want to say is, okay, so you get your testing. Once you're doing your testing, they want to know if you had a physical within the last year, if you had your titers drawn, if you had all of your shots, if you had a COVID shot. Some jobs don't require it. A lot of them, if you're inside of a hospital, they do, unless you have some type of what do you call it, a religious waiver. But a lot of places want that up front when you're signing up with the travel nurse agency. So there's several travel nurse agencies out here. It's some that have people that you can't even understand. It's some people that talk really slick like salesmen. It's some that will take their time with you. It's some agencies that you can just go on the app and see how much they're paying in this recruiter list. So you just apply, and then after you get the job, then you'll have somebody to help you along the way. But with the recruiter jobs, they get a cut from your check. With the recruiter list jobs, it seems like they pay a smidge more. But I mean, the company is taking a portion out anyway, because if it wasn't for the company, you wouldn't be getting the job. Okay, so I talked about the resume. I talked about references. I talked about testing. I talked about studying for the test because you're going to have at least 4 to 5 tests before you can even start travel nursing with that agency. And if you fail those tests after doing 3 takes, they cancel the contract. Say you get it, right? In order for you to start working, you have to take the test. You got to pass a drug screen. You got to get blood drawn. You got to do a physical. If you don't pass the test and you get the physical, the blood drawn, all of that stuff, because the agency pays for your physical, your shots, whatever testing, your urine drug screen, all of that. They pay for it out of their pocket so that they can get you working and they can get money from you every week because they're helping you to work. So if you fail your test, they will cancel that contract. And there's no way that you can go to another agency and try to get the same contract because the employer is going to say, okay, but wait, you were already working with so-and-so agency and we offered you the job and then something happened, but now you're with another agency and you want the same job. What happened? So if you tell them that you failed your testing, your compliance testing, they're not going to want to work with you anyway. So if you fail, it's okay, it happens. Look for another job. You don't have to leave that agency. You just look for a different job. Now, there are stipulations for some agencies. If they tell you you can't work for our agency for 6 months because you failed in this or that, then you go to another agency. If you're applying for a job, say you're doing flu vaccinations and you apply for this job and you failed the testing, but your background is case management or outpatient clinic or outpatient surgery, you still can apply. But for anything that you the first job that you applied for that you failed, you can't do anything with that for 6 months. You can go with other specialties because you have to show that you're compliant. And that's, again, like I put in the chat, you go to Quizlet, you type in whatever the title of the test is, you go through their flashcards and you study because a lot of those are verbatim the question and answer to those compliant tests, those competency tests. Magician, do I support? I don't know. I don't even know. I'm not even gonna get to lion, manifestation, magician. So okay, anyway, so now that's done the testing. Once you get to getting your assignment, because I think the testing and the physicals and titer, that's the last portion before you can start. Once you get done with that, you have to wait for your start date. So your start date could be anywhere between 2 weeks to 4 weeks from when everything was done. If they want something like quick, if it's like a strike contract, then of course you're doing something within a week or so. You got to really be on top of it. But if you are doing a regular 3-month contract, you have to wait. So maybe it's a 2 to 4 week break in between. So, you chilling, right? You doing stuff around the house, or maybe you have a per diem job, which a lot of travel nurses have per diem jobs. So in between, if the contracts are not there, or if something, happens and they have to cancel their contract, they can go pick up hours at their per diem job. So the downside of travel nursing is when you go in this facility, you're going to be short staffed. That's the reason why they're asking for travel nurses. They want somebody to go in the job, have a minimal training. I'm telling you, some places have hours of training before they can just hit the ground running. Some people will have a week, and I believe that's like max. Back when a young lady told me that I worked with that she had 3 weeks of training in a 13-week contract, I was like, wow. That's that's a blessing, because usually you don't get that much when you're traveling. So as you went through the process, you're gonna start your job. You immediately are gonna have the mind frame of, I'm coming in here, it's gonna be some BS. Okay, and I really don't talk like that on my channel, but it's definitely gonna be some bull when you get there. That's why they paying you more, because they're short. It's gonna be some trash that you gotta jump into and try to clear it all up and make it smoother. And what keeps you sane is you get paid every week. So your first 2 weeks, your first week, of course, nothing, because you're a week in the hole. But your first 2 weeks is probably going to be the hardest, because you're trying to learn this facility or this clinic or this hospital or this skilled nursing facility, long-term care, wherever you decide to go. You're learning their not necessarily all of their policies, but you're learning how the flow is there. And then when week 2 comes, you kind of get, if you're a quick person to catch on, you have to be quick with it to be in travel nursing. If you're not one to quickly catch on, don't even start. So you have to be quick to catch on and go with the flow. Once you do that, week 2, you already know you got a paycheck coming. Now, a plus would be for travel nurses, you get reimbursed when you're you out of here? Mm-hmm. See ya. One good thing about travel nursing is when you get reimbursed for clothes or shoes. So some agencies will give you a certain amount where they'll reimburse you. So say they give you $100 on your next check, or say you had to get a what do you call it? A license in another state, and you come out of your pocket, they'll reimburse you on your first check. So it's a lot of reimbursements that go there. But what I will tell you is, make sure that you are getting information on parking. Out of the time frame that I was traveling, from my first assignment all the way down to the one that I had at the beginning of this year, know how much your parking is and tell your recruiter, I need my parking reimbursed. For me, I believe parking was like, for 3 months, I think I paid close to $200. Let's just round it up. And if it wasn't for me getting that information and saying, hey, in my contract, I need to be reimbursed this amount, because we have to park in these structures, and the employees don't pay, but the travelers do. So it's not all peaches and cream when you go in a facility as a travel nurse. Some people are jealous that you're coming in there, and they think, just like some people in the comments of my shorts that I've been doing, they think that you are getting paid $10,000 a week. Those days are long gone. Long gone. Okay, realistically, you getting paid anywhere from $2,500 to $3,500. And if you work like a regular 40 hours a week, 5/8, then you probably in the between the 3,000 and under range. And 3,000 is if you probably going to California or something like that. If you are working the floor, a lot of the agencies now, usually it used to get a good amount of money for 36 hours. Now, to make things look better, what they're doing is they're making a mandatory 48 hours. So like, wait a minute, that's overtime. But they entice you with this, oh, well, you'll get $3,600 or $3,800 a week, but you have to work 4 12s. And you don't get the overtime pay because you already signed up for 48 hours. So that's trash. I don't work bedside anymore, so I didn't have to worry about that. I've always worked just the 40 hours, but it's terrible, for them to force you to do 48 hours just to get that extra little, and it looks good weekly, but your body is probably not going to be used to that. So you gonna be beat down a little bit, trying to get that little extra $600 to $800 a week. But it is what it is. What you mean, can I please wear some clothes? You know what? I have a whole two-piece on, and I'm trying to cover up my little stomach because I'm a little bloated. But I have on clothes. I just got my computer right here, and thank you anyway for your comment. You know, somebody commented on my outfit last time. I had a whole jumpsuit on, but I had cleavage out. We are adults, and if it bothers you, I apologize. But I'm not going to dress with a turtleneck when it's 80 degrees outside. Unfortunately, I'm not. But anyway, um, so what else was I talking about before I was interrupted? So with travel nursing, the plus side, of course, is you getting a weekly rate, a good weekly rate. But if you're doing local, whatever that weekly rate is, they taxing all of it. When you're doing travel that's outside of 50 miles, you have a tax-free stipend. So let's say out of your $3,000 check, $1,500 is tax-free. That means they're only taxing the remainder $1,500. So it looks better when your take home is like $2,800 or $2,700 a week. So that's a plus. In some cases, depending on where you are and depending on how long you've been away from home, and you know, the IRS may look and say, hey, we didn't get enough taxes from you, so they're gonna want their money at the end of the year. So you definitely want to put money to a side when you're traveling. I mean, you're not used to making that much money anyway. So when you make $2,500 a week and you're used to getting $1,500 every 2 weeks, put that extra 1,000 up a week. That's at least 4,000 you saving a month minimum, because you could do more. But when you make more, you want to splurge a little more, because I've done it. I understand. I'm not judging. Okay, so let's see, Folly. I'm going to school right now for ASN. I appreciate what you are doing for realistic expectations for people getting to the field. And oh yes, I definitely wanted to know realistic, because in a perfect world, and Folly, let me know how it goes. I like to keep up with student nurses and encourage you as you're in your journey, because everybody started from somewhere. And you know, when they say, you know, nurses eat their young, not every nurse. I encourage. So I do like to share the realistic part, especially on my channel. I'll show the stuff that you have to look out for, some of the things that are bad. In nursing school, we weren't shown any of the bad. We were shown in the perfect world. So when you're going to school for nursing, whether it's your associates for registered nurse, or maybe you're doing just your licensed practical nursing or licensed vocational nursing, what you want to do is think realistically. Is my heart set for nursing, or am I just doing this because I need a better quality of life? Now, a lot of people review, thank you. A lot of people will go into nursing for the money because it pays more, but they don't have a heart to care for people. And I believe that last short that I posted last night, I got a part 2 coming out that I'm going to do tonight on that video, because it was so long. But the last video that I posted on the I think she was just a caregiver. I don't know if she was a nurse, CNA, I'm not sure. Whatever her title was, she was in healthcare, and she was slapping this dementia lady around, and it was just so terrible. You do not need to be in healthcare if you're going to do that, because you're going to come across the wrong one that will get you back in the wrong way. So that's all I'm going to say about that. Let me see. First time here. What is your channel about? JoJo. Okay. So actually, JoJo, my channel talks about nursing. I have a little bit of humor here. Some people say that I take it too far at times. I had to apologize for one video. I think it was one where I was slapping my husband. And then it was like, oh, I'm not paying attention, but I'm actually looking. And it's like, oh, it's domestic violence. You don't need to not turn your back. You're a nurse and you're supposed to. It's like, okay, maybe that went too far, but I don't even slap my husband. He don't give me a reason to. And if it's an issue, we usually talk it out. But that video, it was just such an uproar about domestic violence, and they took it too far. So my humor is there, but then I realistically talk about what to look out for when it comes to healthcare, what people are not really showing, or what you may have seen, but I'm trying to pull everything. So from the people that's getting elderly abuse or showing the short staff, people in nursing homes where people are wiggling out of the bed face first, showing the good things about nursing. Like there was a young lady in, I believe it was New York, and yes, they are very sensitive about stuff, very sensitive. And even my post that I did last night, I talked about who has ever been abused, but I put the link of that, and I was in my mind, I was thinking of elderly abuse. Like, have you ever been abused from a caregiver? And a lady was like, how dare you put somebody's sensitive information to see for the clout of your channel, or whatever she said, and was like, whoever wants to be abused. I had another subscriber say, come on now, if you clicked on the link of the video, because she said, I'm unsubscribing. The other person, big ups to you. She said, if you clicked on the link of the video, you'll know what she means. So I went in a comment and I said, you know what? I apologize. I was talking about assault more than abuse. But I said a caregiver. I'm talking about non-family. But I mean, family can be your caregiver too. But she took it totally different. You can't please everybody on the internet. And it's okay. So if if she's unsubscribed because of that, I said, well, thank you anyway that you subscribed in the past. You have a good day. Because I mean, I'm not going to sit there and try to go back and forth with anybody because they misconceived what I thought I was saying correctly. And then I cleared it up in the comments. But anyway. So let me see. I was saying something. Let me see. Go back. Yeah, definitely. I want to tell the truth about nursing. So the young lady that was in New York, I think, that was in a wheelchair, she had 76 interviews. 76. 75 people told her no. The 76th person said yes because she was in a wheelchair. She graduated, got her registered nurse license, her degree, and they told her no because of her disability. Now, I don't know per se. Who is that? Who is that? Oh.
I forgot Tosin's dress, or the dress she
Oh, okay. She here?
Huh?
You brought her here?
No.
Oh, okay. Sorry, I'm talking to my middle child. She just turned 18 yesterday. I'm getting old, y'all. Anyway, so out of all of those people, they thought about, like, I don't know what position she was trying to work for. I don't know if she was trying to do med surge or ER, ICU. Sometimes you physically really have to get down with the patient to really help and assess, and like pushing, pulling, twisting, and all of that with your body. It happens in nursing. So I don't know if they were just looking at her in a wheelchair and saying, oh, well, you're disabled and you can't get this job, which is unfair. But hopefully wherever she is, as a new nurse, I don't think she would be triaging because you have to have the nurse judgment first. But hopefully wherever she is, she will be beneficial and she will continue. And when people come and say, hey, what are you doing in this area because you're this or you're that, I hope she keep pushing. I don't know her personally, but I congratulate and applaud her for keeping on to apply for all of those jobs and land that position. She may just be in an outpatient clinic. You never know. Okay, let me read some of these comments. Let me see. You are so right about making that decision about being a nurse. Yes, your heart has to be there. I'm just a CNA right now. Yes, you definitely have to have a heart for it because people are going to realize, like, if you there for the wrong reasons. But what I'll tell you is, a lot of people do start for the right reasons, and then they get tainted by, you know, the wrong department they're in, and they emotionally and physically can't handle it. You know, they may be going into a psych ward and they really can't handle psych patients. Like, why are you even there? Or they may not be able to handle a lot of things going on at one time, like in the ER. So you need to learn out where you want to be at so that you can continue to love your job. It's always going to be patients that are upset, that will yell at you, that'll cuss at you, that'll scream at you because they are in pain or they're frustrated and they want to take it out on the nurse, not the doctor, but the nurse or the nurse assistant or the CNA. We are the ones that get chewed up from patients. The doctor gets it at the tail end. So once you know that patients are not always going to be so sweet and loving, they're going to chew you up sometimes. If you have a heart for it, you just say, you know what? I understand you're going through so and so. Let me give you some space, but let me give you your medication first, and blah, blah, blah. And then usually at the end of their time frame that they're with you, they apologize. Because this happened to me as a brand new nurse, as a nurse that I am now. It doesn't even bother me. It doesn't, because I know that eventually they're like, you know what, I'm so sorry I was being, you know, a butt munch or whatever. And, you know, I'm like, oh, you all good. And then if I see them again, I kind of joke with them. So now we have that relationship of, oh, hey, nope, we ain't doing that. And then we both smile or something like that. So I understand it's not about them being so hard on me. It's something that they're dealing with, and you just got to let it roll off your shoulder. Okay, let me see. Tip on saving hospital bills. Beginning of the year, all hospitals have programs to aid to pay for bills. Okay, JoJo, thanks for that tip. Let me see. But then they get used up quick the end of the year, and there is a run. Okay, so the beginning of the year, the hospital has some extra little aids for help. But towards the end, it's like slim pickings. Gotcha. All right. Bob Smith. I once went with a girl from Jarbidge, but she had a bit. Bob Smith, what's going on? Okay, I'm not about to read that. Okay, yeah, that was funny for me. Okay. Fally, did new dead nurses have a good chance at working day? Oh, probably new grad. Oh, yes, okay, new grad. New grad nurses have a good chance at working days. Or as a new grad, are you guaranteed to pretty much start nights and have to work nights for a while you start to work days? Okay, so Fally, and hopefully I'm saying it right. Fally. Hopefully one of those. Um, when I was a new nurse, there was no day shift. I mean, and that was 8 years ago. There was no day shift. When you first start, it had to be nights. Only because the night shift people, you know, they started off nights, and the day shift people wasn't leaving. And then eventually, after like maybe a year at the job, you can I'm sorry, my nail chipped. At the end of the job, you can, I mean, at the end of the year, somebody had left. Depending on if your department has a high turnaround, like the ER, somebody had left, and eventually, whoever was next for nights to go to day shift, then they did, or they would go up to to afternoons. But for now, Fally, tell me which one is it? Is it Fally or Folly? Because I've been saying Fally. Let me know if the first one is right, Fally, or Folly, the second one is right. Because I want to say your name right. But right now, I believe it's easier for day shift for new grads, because hospitals are short across the board. So if you want a day shift job and they have an opening, yes. Afternoons, if that department has an afternoon shift, yes. Midnights, of course, midnights is always going to be open, but some places are full on midnights because people like to work when there are no managers around. Because most of the time for nights, you're not going to really have a boss out there like that. The bosses are all there on day shift. Um, so question, Fally, Fally, perfect. Which department do you think you want to work in when you get done with school? If you have that already, and if not, when you're doing your clinicals, start looking and start networking with people. So if you like a department, network with that not the hiring manager, but network with like the charge nurse or the nurse manager of that department and say, hey, I really like it here. Can I get your information so when I graduate, I can see if you have any openings? That's a good way for you to get a job too. Okay. Ugly beard. I'm studying medicine and I'm lucky I am not going to be a nurse. Ugly beard. What kind of medicine are you studying? Are you well, when you say I'm studying medicine, I think about multiple things. I think about the residents that we work with. I think about, of course, the doctors, but the doctors have to be residents. I think about PAs. I also even think about nurse practitioners, but a nurse practitioner is a nurse. You just go to school a little bit longer and you have more experience. So let me know, Ugly Beard per se, what type of medicine are you studying? And anybody else that have questions about travel nursing or anything in particular, you can put it in the comments. I'm here for you. Let me see. What else was I saying about travel nursing? So, of course, let's say in a perfect world, let me see. Awesome. Thank you for the information. I appreciate your time. And you have awesome vibes, super positive and very kind. What is the best department that you would recommend? I'm interested in peds. Okay. So, Fally, when I started nursing school, I love little babies. I wanted to be a labor and delivery nurse. And when I found out, not saying this is the case for peds, but when I found out that there were a lot of medical malpractice around labor and delivery, I'm like, ooh, let me stay away from that because I don't want to get sued for something that was done and I'm a part of that team, so they bring me in too. Plus, if there was a stillbirth, I would cry. I would cry with the parents because I really love little ones, and that's why I showed those videos of the neonatologist, reviving the baby, and hopefully it didn't trigger too many people, but reviving the babies. There's 3 different videos, and I wouldn't have showed something that didn't have a happy ending when it comes to babies, because when you can't get that baby back, it scars you. And I still to this day remember my first patient that died on me, but it was her wishes and she wanted to switch to hospice. You never forget those patients. So, all right, let me get back to, but yeah, peds. When you're doing your peds rotation, see if you really like it. What I will tell you with peds is you definitely need to be on top of your medical math, because the dosage, sometimes you have to calculate your own dosage to double check stuff. Do not always think the pharmacy is going to do it, because you're going to see stories of pharmacy overdosing these babies, and you as a nurse, if you're not double checking these ped dosages, and you give them the amount that's on the bag, and you kill that baby, they're not going to just come for the pharmacist. They're going to come for you too. So be really cautious, not to scare you though, but be really cautious with the ped dosage, because you don't give them the adult amount. That's what I'm going to say about pediatrics. I love babies though. I love them. Love them, love them, love them. I probably would want to bring all of them home because I'm a mom of 3 girls. So I would be taking all of the baby boys. Okay. So, with travel nursing, let's say you make, let me see, let's say you make $50,000 within those 3 months. That's some really good money, right? Um, you you can always no, it's okay. Don't worry about distracting me, Fally. This is why I'm here. So, I wasn't gonna necessarily talk about travel the whole time. If people wanted to talk to me about things, I have no problem with that at all. But yeah, with travel nursing, if you make 50,000 for a 3 month contract, that's perfect. You put money up, you save it, you take some time off in between contracts, and then you go back to work and do another 3 month contract. Or in some cases, you can extend. If you like the place like that, you can extend for another 3 months if you want. With um, with working as a travel nurse in some of these hospitals or wherever you decide to go, you have to look out for jealous workers. Staff can be jealous because they busting a butt and they getting less than what you're getting. But some of them don't even know all of the stipulations of what you have to do to even get in there to work as a travel nurse. Of course, you're getting paid more. Yes, that's what's enticing you to get there. But when you get in there and you're working with them side by side, they're going to think that you're going to have a heavier caseload because you're getting paid more. No, that's not always the case. You getting in there with that amount to help them. So they should be thankful that you're there. And if you're cool like how I am when I'm at work, I'm like, you need anything or we can work together, we can team this up. Because you want to make it seem like you're helping them to make their workload lighter. Or if you need them to help you, we can team up and let's go take care of this patient together when it comes to this. And let me know if you need me. It's always a team effort. Nobody likes somebody that comes in there and they snooty, and of course you making more money, so you like, I'm only here to do this and that and I'm not helping nobody else. You think that staff person is not going to reach out to their manager and say some slick stuff to get your contract canceled? You got to be careful. So as soon as you think you getting all this money and you come in there with the wrong attitude and somebody is jealous about that and you already running your mouth, they have a reason to talk to their boss. And the boss not going to come to you. The boss is going to go to your recruiter or going to go to the, what do you call it, the account manager for the agency, and they're going to relay a message. Today is the last day of the contract. They'll smile in your face. They won't even come and say anything to you. They'll go to the people behind the scenes, and then you'll be relayed a message. Oh, well, it was told to me that they're canceling your contract due to lack of whatever. So you got to be cautious when going in these facilities and you get more money. You humble yourself. Most of the time when you working with travel nurses, they all cool because we already know what we got to do and we got to chill out because we know that we're going to walk in this thing and it's going to be a hot mess. So the travel nurse that I posted a video on that was in a long-term care facility, it was her and another nurse, and one nurse refused to pass meds on one of her hallways. She was venting, so she did a TikTok, and I'm not mad at her for doing that TikTok. I mean, she did it probably in a med room or something, and she probably just wanted to just blow it off. Me, I can wait until the end of my shift to do that, and I can record in the car, or like I said in the other video, I can call and debrief and talk about this to my mentor that I have. But you're not really going to catch me recording at work because I don't want anybody to say, oh, well, we're going to fire you because you've been recording on our grounds and you're not taking care of blah, blah, blah. No. Thank you so much, Jared. But yeah, it's pros and cons to travel nursing. But guaranteed, people are not getting $100 an hour anymore. If they are getting $100, it's probably because, hold on one second, y'all. It's probably because if it's overtime. If it's overtime, yeah, you can get $100 an hour, depending on what your contract is saying. Any other questions about travel nursing or nursing in general? Let me know. Um, I'm trying to think of some other things. Cause you know what people do is they advertise. Like if you ever been in any of these travel nursing groups, like I'm in a few of them on Facebook. They advertise. Oh well, this place, this city, this state, whatever department it is, making this amount of money this week. This is the stipend. This is the hourly wage. They make it sound so enticing, but then if you don't know this place, because I've seen it in these groups where they'll ask, hey, have anybody worked at, let me give an example, Sinai Grace in Detroit. Now, I'm in Michigan, so I know about Sinai Grace. I don't really respond to those, but it's people that will, and I shared a video of somebody getting shot in Sinai Grace, a worker getting shot in Sinai Grace recently in my shorts. Um, so people are really trying to get the tea before they even sign up, and I don't blame them because sometimes these environments can be dangerous. Just because they paying you a good amount don't mean that you can just walk in here and not really pay attention to your surroundings. It's dangerous. So y'all think, like I said, it's peaches and cream getting into travel nursing. Oh, you signed up to get this. Plus, you're leaving your family. When I went to Cleveland, because I'm in Michigan, so Cleveland is a couple hours away. I had to live up there. I had to leave my husband and my daughters, and I had such a good schedule. I saw them every weekend. I saw them 3 days, and then I went up there and worked 4 days. So it was perfect, but it did a toll on me because I've never, out of my time frame of traveling, I always did local, or I did it where it was far enough for me to get the tax-free stipend, but I could drive home every day. So when you leaving your family, I mean, I had some sleepless nights because that wasn't my house. That Airbnb was not my house. It was clean, it was nice, but it wasn't my home. The walls weren't gray like how my walls are gray. They were white. I couldn't hear my dog barking or the cat meowing. I couldn't hear any of that because I was in a Airbnb away from home. So of course I FaceTimed every night, and I wasn't there for homework for the little one. My older ones, they didn't really need me so much when we got on the phone and we talked, but it does a toll on your body because it's something that you're not used to. Now, if you're single, you don't have any children, then you could just go wherever you want. It probably don't bother you. It might, because it's not going to be the comfort of your home. It's going to be the comfort of that hotel or that Airbnb or that furnish finder that you were living in for that time frame. So it is what it is. Let me check some of these. Do they cover travel costs for you, like plane tickets or gas to get to your destination? Fally, they do cover travel costs. For me, what I did when I was going to Cleveland, I rented a rental car. So I literally would drive. I would drive 2.5 hours twice a week. So I would, on Monday nights, because I would be at home from, actually, so Fridays I will come home after work. So my full day was Saturday, Sunday. I'm always home. And then Monday evening, I would drive. After my husband got home, if he had to work that Monday, I would wait for him to get home. And then I would drive to Cleveland. So I would have a rental car for maybe Budget or Avis or Hertz, whoever gave me the discount, because your agency has a link of discounts that you can use. But if you don't know, you don't know to ask. It's discounts everywhere. So I would use whoever gave me the best rate, and then I would just rent a car. And they give you your stipend, Valley, is your housing and your meal. So they would give you a certain amount anyway. So what I did was for my rental car, I would make sure that it was way less. For my Airbnb, I would make sure it was way less combined. And then I would just get food from the grocery store and put it in a cooler in the car and drive it up there. So I didn't have to really worry about eating out. And I would pack a lunch. So I was cost efficient because I was saving my money. I was spending it too, but I was saving my money because it was a time frame where I came home and I needed to help my daughter to get a car. The one that just left, she had bought a car and I helped her. She saved up a good amount of money and I still gave her some extra to cover some things. And then also, my oldest child was going into college, so I wanted to make sure that I had money put up for both of them so that I could give that when they needed it. Okay, let me see what else. Hello. Let me see. Mm, Coaching and nursing with TT. Just started watching, so not sure if you've answered this. How long would you suggest working as a new grad before traveling? Okay, so most of the time, the agencies want you to have 2 years, and that's 2 years in one specialty. So you see a travel contract, and it's dialysis. They want you to have 2 years of dialysis experience. If Thank you, Fally. I tried. Look, 3 kids. I have to be. My husband is such a help. But before I was married, my first two, I was a single mom. So I went to nursing school, and those two little ones, I grind for them. Now they're my older ones, and my husband was. We were dating back then, but now that we're married, it's better. It's better in a household with bills with two incomes. But sometimes my mind is stuck on single mom, even though I've been married for about 8 years. It's terrible to say that. My mind is still on single mom mode because of the older ones. But that's why I always grind. I mean, that's why that's why I work full time as a nurse. I have this channel that I didn't know was gonna even blow up this quick because my old channel, I had about 25,000 subscribers, and then it got hacked at the end of last year. So I was so distraught. My husband and I have something we call Peer Space. We have a creative space where he likes to do photography, center photography. So once we soundproof it, I can do more content in the space, but we rent it out on Peer Space for content creators that want to come and do videos, people that do podcasts. We've had a podcast in there recently. If they want to do pictures, we got backdrops, we got a flower wall. So that's another hustle. You have to have multiple streams of income in this world right now because, baby, the economy has increased, but the income of these jobs have not increased enough. And then my last hustle is my scrubs, my petty scrubs. So if you ever looking for scrubs, in the description is pettyscrubs.com. Right now, I don't know if anybody is looking for scrubs with this. I think today is the last day. I did 40% off the entire website. So I have a lot of women's scrubs. I have a few male scrubs left. I think maybe sizes XL, 2X, I think maybe a large, but they're only navy. But for women, I have light blue, I have green, black, wine color, I have gray. I have like a little pleated top. I got that's in navy. I have a tulip top that's in gray. But you get them while the supplies last, okay? Because I did 40% off the entire website, and most of the scrub sets, if they're still sets, sometimes I'll break them up because everybody is different size top and bottom. My zipper sets, half zipper, are like $50. You can't even get a set for $50 in Scrubs and Beyond. You can't get that. And then I have newer sets that have shirt, pants, joggers, and then it's a jacket. Those are $80, but right now everything is 40% off. So go on there. if you want to get some scrubs and support your girl. I even have the little what you call them, the badge reels that you clip on, and you put your badge on there and you can pull them. Also have badge cards as well as compression socks. So go on there, pettyscrubs.com. You know, I'll put it in the chat, but if you want to get it right now, I have, oh, what is the, let me see, what is the, there's a coupon link. If you look at my, if you look at my story on IG, because I don't know the link per se. Oh, I'm sorry. This is what you got. This is what you could do. Um, you can use this code because I put it out on YouTube. This is the code to use to get 40% off of the entire site. I just put it in the chat. YouTube 40. That is the code if you want to get any scrubs or anything that's on my website. I even got down to like little highlighter syringe markers. Okay, 40% off. So go ahead, because sometimes here and there I do throw little discounts on the website because some people may not be able to afford, you know, $50 right now, but if it's a discount they'll get it, or they may not be able to afford a $80 set with the jacket. So there you go for that. Let me see, did I miss anything else? Oh, another thing, coaching and nursing with TT. So new grads, they do say 2 years, but in some cases 1 year is good enough. If the place is, excuse me, if the place is desperate and they need people, that 2 years goes away. They'll do 1 year. And what I'll tell people is, if you've been a nurse for 1 year, you better know what you're doing, because you're still a novice. Novice nurses are under 5 years. I work with a novice. She's about 60 plus years old, and she's still a new nurse. Just because she's older don't mean she know everything. And I'm showing her some stuff because I like to be helpful. But please know what you're doing when you get into travel nursing and you're only doing for 1 year, because you're going to have minimal orientation. They're going to expect you to know what you're doing. And remember, you can lose your license anywhere. So if you do something so bad to where you get reported and they remove your license, you would be double checking on, why should I do this? I should have waited. So that's why they say 2 years. But what I'll tell you is, if you've been a nurse for, say, 10 years and you've worked multiple specialties, what they do want is for you to have nurse judgment. Now, if you've been a nurse for 10 years, you have it. Definitely. You have nurse judgment after about a year or two, to be honest. But to be well-rounded, if you moved around in different departments and you want to apply for something, what they want for you is, if you apply for, say, infusion. Most of the time, infusion nurses, they do chemo. So say you want to do infusion, but you're not chemo certified. Most of the time, unless, because I got in a job where I did it, but I wasn't chemo certified. Unless they are desperate, they will not let you come in without a chemo certification. They just put me in the port room, so I was just accessing ports, PICS, trialysis. But if you've been seasoned, right, 10, 20, 30 years, and you want to work a department that you worked at 10 years ago, they won't let you do it, because they want you to have recent experience, because stuff changes. So, like for me, I worked in the ER when I was a brand new grad, brand new nurse. Fresh out of school, I worked in the ER. Recently, since I was doing case management and just kind of outpatient stuff, really I didn't do too much with the patient. I went back to the first ER that I worked at, and I have a per diem job. So I miss that patient touch, and I miss doing IVs and all of that stuff, which I'm really good at them. So going back, I thought things were going to change a lot. It was the same stuff. But sometimes the policies may change, or sometimes the, what do you call them? The, sometimes the way that you learn is different. Like when CPR class, it used to be um, airway, breathing, and circulation. Now it's circulation first. So stuff has changed, but they want you to have recent. I think one place they said that within 3 years you got to have at least a year experience in that area. So they're particular about that for sure. Okay. Jared, gotta go, but I'll be back for your beauty and wisdom piece. Okay, Jared. Emily B. I don't know, Emily, if you was trying to say something else in particular. Okay, bra strap showing. Sorry, y'all. Um, Let me see. I think I'm going to get to another hospital within the organization to get better patient acuity. Good. How long have you been a nurse, coaching and nursing with TT? And anybody else that have any other questions, comments, concerns, feel free to put them in the chat. Just gonna drink some water really quick. I appreciate y'all for tuning in with me, and hopefully everybody has given me a thumbs up on this video, because it's about 105 of you guys here, so at least y'all can click that button over there and let that thumbs up kind of light up. And if you see me, you're not subscribed yet, feel free to do so. I'm one to always post content of YouTube shorts around 7 p.m. on the daily. I'm consistent. That's probably why this channel has blown up so good. I appreciate that so much. And let's see. Okay, 6 months. Okay, yeah, definitely get more experience. What department are you working at right now? You said, I'm going to wait until 1 year. Think about look bad to move over a year. I'm sorry, y'all. I'm running my mouth, so I needed to rehydrate. Water is the key. Okay. Let's see. I know a few people that got into nursing home. One had only been a nurse for like 7 months. I don't know how she's able to pass meds. So coaching you in the ICU? Stay there. Okay? Stay there for a little bit. And people really let me tell you this before I go back to this nursing home comment. People really like when you start off in the ER or the ICU. Critical care is everything. So when you're working in the critical care environment, having that foundation is like, it's higher than anybody else. Like if you start in labor and delivery, it's different than when you start in the ICU or the ER. And especially when you're applying for things. If you want to stay there, coaching with tell me your name, coaching with nursing with TNT. When you're starting with that foundation of trauma, critical care, and you're going into other places, say eventually you get down the line and you want to get into management, or you want to become a supervisor or nurse manager or nurse assistant manager, they're going to want to know what your background is. If you're just a clinic nurse, they're going to be like, okay, we want to know if something happens, are you going to hit the ground running to go towards the issue to help, or are you just like, oh my God, I don't know what to do because I've never worked in that. So the ICU is a good place to start off. Definitely, I would say stay there for a year. You'll learn more as you're there. But if you want to travel, do you want to travel in the ICU? And do you know what is it called? What trauma level hospital you're working at? Is it trauma level 1, 2, or 3? Okay. So you said you know a few people. Is it Dion? Hopefully I'm saying it correctly. I know a few people that got into the nursing home and only been a nurse for like 7 months. I don't know how she's able to pass meds. I'm sorry, it was like a mosquito or something in my house. I was not about to let that bite me. I got all the skin out and I'm not about to let it bite me. Okay, I'm sorry. So, um, okay, you said you just talked to your wife. She needed scrubs. Can you tell me where to find them? So, Jared, if you look at the top, I wrote pettyscrubs.com. Right up underneath it, I put the code for 40% off. It's YouTube 40. If she puts that in the cart before she pays, it automatically takes 40% off the entire website. So hopefully her size is still available on that website, but it's in the comments. Let me see if I could pin it. No, because I won't be able to pin both of them. So it's in the comments. If you scroll up a little bit, pettyscrubs.com. And the code for 40% off is YouTube 40. Okay. Let me see. Back to you, Dion. I'm sorry. Or here. Let me just put it in here. I'm putting it in now, Jared. Okay. Um, so with the nursing homes, being that the person was only a nurse for 7 months, is this a RN or LPN? I mean, I don't. It really don't even matter if it's RN or LPN because the LPNs, well, in my state we call them LPNs, in other states they call it LVNs. They really run the show in nursing homes. Of course, the RNs get paid more money, and then the when you have a RN in the building, they can take more higher acuity patients, if that makes sense. Because say someone is getting discharged from the hospital and they need TPN, you need an RN to do TPN. Unless they have changed something within the last couple of years, they need an RN to be there to give the TPN drip. Okay. But for the person that only be a nurse for 7 months, okay, let me tell you this, Dion. What I will say, when I graduated nursing school, there was a nurse that passed boards. She was in school with me. She passed boards and she was working, I believe she was working at a nursing home at the time. Do you know, because she was a CNA, do you know when she passed boards, they offered her a DON position? Do y'all know what a DON is? Oh, Dion. Yep. So if she's an RN, they really need her. They really need her because she is giving them the ability to have a higher acuity of patients. So they bringing in any and everybody. And of course, they give the RNs more money. So let's say, prime example, just an example. For the RNs, let's say they give you $45 an hour. You dealing with more stuff. You have minimal staff to help you, like in a hospital, like respiratory, if something happens with a trach, or physical therapy. Well, they do have PT. They have a lot of things, but if something happens, you can't just call a doctor and they come running like if you're in the ER. You have to page them, you have to wait for instructions, or you may have to call a nurse practitioner. So the RN, they're gonna give $45 because it's gonna make it seem more enticing than the hospital giving you maybe 35. With the LPN, they may give you 38, which is still good because in hospitals they may try to give a LPN maybe 28 or $30. Those are just examples. I don't know what they're giving right now, but when I graduated, one of my friends that was an LPN, she said, "Hey, I can get you in this nursing home, and we'll pay you $45 an hour." I was like, "Whoa!" Now that sounds like a lot. When your last job that you got, you was getting like 18, $19. For them to say $45 an hour, that was a big jump. But I did not go into it because I wanted to work in the ER. I didn't want to do long term care. Not to start off, definitely didn't. So I would end up going in the ER and loved it. Loved it. Okay. Let me see. I feel like, oh, I'm sorry, I skipped one. I skipped a few. Hold on, let me scroll up. I'm running my mouth. Okay. My name is it Tarbia? Tarbia or T? Thank you. I'm gonna say T. Okay, I want to travel in ICU. It's more like a step down rather than a true ICU. Okay, okay. So if you want to travel for the ICU, what the agencies may want for you to have on your resume and for them to know is what trauma level is it. So you can get the trauma level from just googling your hospital and say what trauma level is hospital so and so in whatever state in whatever city and state that you're in. So it's some level 1 traumas hospitals that's in Michigan that I can tell you at the drop, like, oh, this is a trauma 1, this is a trauma 2. My first ER that I worked at was a trauma 3. So we didn't get anything. So I actually worked I worked 2 ER jobs. One was part-time. They didn't have anything full-time, but I wasn't going to not work as a nurse. So they got me in first, and when something became available that was up the street, I worked full-time from them, and they were trauma 1. So I went per diem. So I just picked up with my first ER, and then I continued full-time with the second ER. So I worked 2 ERs at one time. But anyway, okay. Definitely stay in the ICU though, T, if you want to travel for sure in the ICU. Stay in that ICU. Just stay there. And even if you get your experience, because there's going to be a lot of drips, drains, and lines in the ICU that you need to know. It's going to be, because I worked in the ICU before, not long, because I injured myself trying to push and pull a heavy patient when I was pregnant with my last one. So I couldn't even do it anymore. But you're going to want to learn all of those drips and drains and the chest tubes and all of that stuff. You're going to see all of it in the ICU if you haven't already. So getting more experience there is a plus. Okay. This is confidential. You shouldn't share that. What's confidential? Tell me what's confidential that I shouldn't share. Okay. The hospital I'm currently at is more of a step down, not a true ICU. That's what the travel nurses say when they work with us. Oh, okay. Well, if it's a step down and not a true ICU, then it should be a little bit easier for them then. Let me see. I feel like nursing homes are just letting anyone come in due to staffing. Dion, yes, I agree. I agree because, like I was saying before, the young lady that I went to nursing school with, she passed board. She worked at this nursing home as a CNA, and when she passed boards, she was offered a DON position, director of nursing. As a new RN, that's dangerous. You don't even have nurse judgment yet. So they offered her this DON position. I think she was making, it sounded really good too, because we weren't making nothing to going into making this. I think she was offered, I think 80 or 90,000 a year, which if you naive, you would say, oh, that's some good money. But when you become a nurse for a little bit and you know that DONs have the weight of that hospital on their shoulders, the staff, the patients, the family, you have the weight of everybody on your shoulders when you're working, and you have to make sure that that skilled nursing facility is compliant, because if something go down, it's on you and you can lose your license. So that 80, 90,000 wasn't enough. But like I said, coming from making nothing into her getting a position as the top of where she could be there was dangerous. But she took it, and hopefully she's still doing okay. I haven't really reached out to her in a while. It's been some time. But I was happy that she got it. I just didn't know the severity of being a director of nursing, especially as a new grad. You got to protect your license, and that is not okay. I'm surprised. What? I am surprised you at times feeling you're underappreciated. I have always thought that you guys are true. Okay, so David, what I'll say is travel nurses, I don't think that travel nurses are underappreciated at times. Sometimes, yes. But it all depends on, like, if you're treated a certain way because someone is jealous, or if you coming in wrong, they're going to treat you a certain way too. Nurses, I can say as a whole, feel like they're unappreciated when they're not treated. Oh, you know what? I think, David, you might be talking about when I left my staff job because I felt underappreciated because my boss was allowing somebody brand new to work from home. If you want me to tell the story, I'll tell it. Just let me know in the comments because I won't veer off if you don't want me to. So if y'all want to hear the story, say, tell me the story, and then I will. Let me see. What else? Oh, I'm missing a whole bunch of comments. Christian B, hello. Let me see. I'm a CNA at 16 years old. Oh, bless your heart. I work at a retirement home. My goal is to be a travel neonatologist. Come on now. You must have seen that video. I know you've seen him. I got 3 of them of that man. He is a neonatologist. He is awesome. The Egyptian doctor, he's awesome. My goal is to be a travel neonatologist and a pediatrician. Any advice for me? So let me see. Let me keep reading your stuff. I'm going to college on a full ride for RN. Okay, hold on. Okay. Now, if you're going to college on a full ride for RN, you know that neonatologists and pediatrician are doctors. Registered nurse is different. So if you're going for nursing, if you want to still be in that field and don't want to go so far out in school, well, this is what I'll say. I'll say this. If you got a full ride to be an RN, go ahead and do it. You can get that foundation of nursing. But doctors are totally different than nurses. Now, say you're in RN school, you get done, and you want to be a nurse practitioner. You can be a neonatal nurse practitioner, and that's a provider. But you're on the nurse practitioner realm. You're still a nurse, but you're higher up the provider area of nurse practitioner. Again, pediatrician and neonatologists are doctors. So you would have to go to medical school and you would have to learn those specialties. But if you're in RN school and you want to stay in that area of RN, moving up the ladder where you are, you can be a nurse practitioner. If you want to be a director, DPN, you can be a director. And I'm sorry, not a director, a doctor. Get your doctorate in nursing. You can do that as well. But that is totally up to you. I won't veer you away from being a neonatologist or a pediatrician, but just know that registered nurses are not pediatricians. You can work in a neonatal area or the peds area as a nurse, but to be up there where it's doctors, no, that's not nursing. But I'm so happy that you got a full ride. Go ahead. I wish I had I don't think I had to. Yeah, I did have a little bit of student loans when I got my associates. I got most of my student loans when I got my bachelor's. Okay. Any tips for me for my age? So you're a CNA, you're 16 years old. What I'll tell you to do is really think, because I didn't think about the medical field until I had my kids and I had my daughters. Oh, I'm really telling my age. I didn't even post this. So I feel old, but I turned 40 on June 11th. And I really I really don't want to say 40. I want to say I'm still in my 30s, but it's a blessing. My husband say it's a blessing. Of course, he's already older than me by a few years, but what you have to realize is, do you think that nursing is for you? How long, matter of fact, is it J Ron? How long have you been a CNA? You said you at 16 years old, you're working in a retirement home. So do you think that that is, hey Robin, thanks. Thank you so much. Robin, you're awesome. Um, do you think that you are liking, the medical field right now at 16? I know my daughter, that just turned 18 yesterday, she was thinking about doing some CNA classes, but she wants to go to school for nursing. She was just trying to get some type of certification where she can work a little bit in the nursing area while she's in school and maybe work on weekends while she's in class. And I just asked her, I said, well, with CNAs, you are cleaning up patients, you're going to have a heavy caseload. Are you ready for that? Because people are not being realistic when they say get this and get that. They don't tell you the realistic stuff, especially in a nursing home. With a retirement home, well, not a retirement home, assisted living is a little different. I would say that's more of a plush environment because a lot of them are more active. So you may just be helping them to get in the shower or making breakfast. But like in a long-term care facility where it's just multiple people that's there and minimal help, that'll really show you if you really want to be a nurse in that area, because skilled nursing facilities are like, whew, they not for the weak. They not. Nursing is not for the weak. And Robin is on here. She's an RN. She can tell you nursing is not for the weak. It's not. It does a toll on you mentally, physically. It does a toll on your body. Like, it's no way that I could go back to bedside because my back. I can't. I already injured myself once, so I'm not going back into that area to re-injure myself. But it's so many things that you could do in nursing once you get your foundation that you can do that's not bedside. You can work for insurance companies. You can do case management in hospital. You can do that working from home. You can work in an outpatient clinic. You can, it's so many different things you could do where you're not pushing and pulling a patient. So, what I will say, Jerron, is even though you're 16, you probably maybe just started as a CNA. I know it probably hasn't been that long because you're 16. So, see if that's really truly for you. See if it's for you. If you don't mind patient care, then keep it going, keep it moving, because that could be something perfect for you. And only you can tell if it's for you or not, because you're going to be the one that's working with each different individual and going through the process. Okay. I work on a okay, alt unit right now, but I work overnight shifts and early overnight shifts. You 16. Wait a minute. So have you graduated already from high school? Because you talked about going on a full ride for RN. But I want to know, where are you? Are you currently in high school, or are you, super smart, graduated already, and you're just in the process of waiting to start college? Okay. Hello, Slim Kid 02. Anybody else have any comments, questions, concerns? And then I'm gonna go back to what David said about he said he was surprised that I felt unappreciated. And I believe that was probably when I talked about me leaving my staff job before going into travel nursing. If you want to hear that story, Comment below, tell me the story or tell me the tea, because if it's not anybody else that want to write anything, I'll tell you the story. And you let me know if you would feel unappreciated too, because I surely did. Okay, anybody else have comments, questions, concerns, hellos? And to be honest, even though, like I mentioned in another live that I had a couple weeks ago, because I've been busy. I didn't do a live last week because I celebrated my birthday weekend, and I was I was enjoying myself. Um, my husband has something planned every day for the week. Okay, Phil, what's your question? Um, I did go back to staff, but I do miss travel. And once, because I'm in the process of doing something where I need to be at a permanent job, but once I get that, I'm like, ugh, I'm itching to go back for travel, because the job that I'm dealing with right now, I mean, it's okay, but your lifestyle that you live when you're a traveler, it's different from when you go to staff. Even though the job that I have, it pays a pretty good amount for my job experience, it's just, I'm dealing with some BS, but it's not from the patients, it's from the coworkers that I share an office with. So I'm like, either I need to transfer out of here, or I'm just going to just go back to travel. But I need to take care of my situation that me and my husband are trying to acquire first. I'll tell y'all more when I get it. Okay, Cindy. Hi, Cindy. I'm 61 and a teacher. Am I too old to go back to nursing school? Absolutely not, Cindy. You are not too old. What part of nursing would you like to get into? Do you have a certain specialty? Can you say amazing? Amazing. Phil. Yeah, Cindy, let me know what area of nursing you would like to get back into, because I know when you start, usually you have to start via bedside, and in some cases you can get into a pretty decent job where you're not doing a whole bunch. I don't know. Um, I don't know what area you're trying to get into, so I can direct you a little bit more. Oh, you want to get into travel? So let me see. Am I too old to get back to school for nursing? You want to get into travel, but what's your specialty? Do you want to do ER, ICU? Do you want to do, they even have school nurses that travel, but I mean, they don't really pay a good amount. But tell me, Cindy, what's your specialty? Because in order for you to go back to school for nursing, whether you're going for your associates or your masters or your bachelors, that's a minimum of 2 years to get your registered nurse. And that's with if you go into a community college like how I did, because you can travel with your associate's degree. You don't have to travel with a bachelor's or a master's. Places don't even care. Um, but I want to know what area you're trying to go into. Do you have a special area for travel nursing? Because you have to take nursing school, pass boards. Oh, you're not sure. Okay. So you have to go to nursing school, whether you want just your associates. Let me know, Cindy, you want your associates, your masters, your bachelors. I think sometimes if you already have like a master's, some programs will allow you to come in and do a dual master. So you're only doing a couple of years and you get both or something like that. But do your research. Um, when you're trying to get into travel, sound like my little one is up. When you're trying to get into travel, you have to have experience. So once you graduate from school, pass boards, then you need to work. So if you don't know what area you're trying to get at, you need to have all of this in your mind, because at 61, you're going to go to school, right? Sometimes you have to do prerequisites before even getting into school. So let's say 61 and a half or 62, you start school. That's my dog, Winston. Hush, boy. Okay. Um, let's say 60, 61 and a half, you get into nursing school, or 62, right? Then you have to take your courses if you're getting for your associates, because I don't know your background. If you have bachelor's, master's, and you can do a program where you can just get more classes in, and or so on or so forth. Let's just say you getting your associates, right? That's another 2 years. Unless you do an accelerated program and you have no breaks in between, do your research, sometimes it's 18 months. So let's just round that up to 63 and a half or 64. Now at 64, you have to get a job as you're working. Remember, travel nursing, okay, you got your master's in education. So what I would say, Cindy, is reach out to your school and see if they have, like when you got your master's, see if they have a nursing um, program, and see if they will work with you because you've already been there, and see if there's an additional dual program where you can go in and get your degree for nursing in a certain time frame. But nursing, it changes your mind. It definitely does, because it's not just regular thinking. You have to chime into your nurse judgment. Once you go to nursing school, and anybody on here that's a nurse, they'll tell you nursing school is different. Now, but yeah, so Cindy, let's say 64, you're done with school, and now you have to work. So whatever department you decide, you have to work in. When you're working, you have to have at least 1 to 2 years. So now that's 65 or 66. By 66, you'll be able to travel. But you gotta know what you want to do, because during all of this time frame, you gotta have the specialty that you want to do. You gotta apply for that and start working as a staff nurse. Once you do that, then you can go and travel once you get a year or two under your belt. It may seem like it's a long, drawn out process, but if that's what you want to do, feel free to do so. But you do have your master's in education. So are you tired of teaching? Sometimes you can even teach, like myself. I want to go back and get my master's in nursing education, because I would love to teach upcoming nurses on, how to become a nurse. I mean, I show a little bit on my channel, but I literally love to have my master's in nursing education. And even when I retire, I still could work as a nurse educator, because I would work online, or I could go and do lectures at the schools. So I still would be working as a nurse. So, oh, you said very tired. Okay. So, yep. Well, reach out to the school and see, and just let them know, hey, I got my master's in education. I want to go for nursing. What should I do next? And then go from there. And hopefully they'll give you what you need, Cindy. All right. Anybody else? I thought my youngest was up. I guess not. Maybe the dog was just barking because people was going across the street or driving by. Dogs. Gotta love them. You're welcome, Cindy. Anytime. It should be more people encouraging. And hopefully out of these people that's still here, that's viewing, if you have any questions that you want me to answer right now, type them in the chat. Hopefully you have given me a good old thumbs up, because you're watching this. I appreciate those. Those are free. Hello. I don't know how to pronounce your first name, but your last name is Gupta. That was my daughter's pediatrician. I miss him. He was a sweet guy. Anybody else have any comments, questions, concerns? Hi, Abby. I am, which country? I'm from the United States. Let's see. Anybody else? What's your weird question, Phil? Hopefully it's not too weird because I won't read it out loud, but I might laugh at it. Because you keep retracting your messages, so hopefully you say what you want to say. All right, I want to study LPN. What do I need? Okay. Um, what is it? What WYD? What you do? Tipsy? I'm hoping I figured that out. Okay, so if you want to study for the LPN, first you need to Google what schools are in your area. And usually with the LPN, that's just a 1 year um, program for school. With the RN, it's two. It's okay that you want to take your LPN first. I have a friend that actually did that. She went from a pharmacy tech to a LPN because her daughter was really small, so she wanted to do LPN first. Then she had to work a little bit and get her hours in, and then she went back to school to be an RN. And then right now she is in school to be a midwife. So she went through those steps in that process. So it's nothing wrong with that. How long did it take you to get a break even for pay? I don't know what you mean. How long will it take to get a break even for pay? I don't know what you mean about the how long will it take to get a break even for pay? OFG. Can you rephrase or reword that? Because I'm not 100% sure what you're talking about. You talking about breaking even from what though? Like when you go to school, running a business? Because I talked about a few things. Phil, what's wrong? You said, can I say, can you say my name? Okay, Phil. Oh, Phil is the man. Okay, that's your name. Um, to pay off for schooling. Okay, so breaking even. What I can say was when I got my associate's degree, there was I had a lot of grants. Back then, I was a single mom, so my income for my household was not as great, and I think I was making maybe 17. Nope. Let's retract. Let me take that back. $13.80 as a phlebotomist. And then I became a senior lab assistant and made like maybe 17 or 18, but I couldn't stay a senior lab assistant long because I had to get into nursing school. So the lab didn't really work with my schedule. I had to work as a lab courier in the afternoon. So now that you know a little bit about my background of when I was a phlebotomist, with that $13.80 for a family of three, I was under. I was under that area to where grants and I got I think maybe I got a student loan or two, but it wasn't like a lot. I think I did that just to help cover for like maybe books or something like that. But I would say when you get grants and scholarships like that, when you smart in school, you break even kind of quick. But that was because I was an associate program, an associate degree, so 2 years, a community college. When you go for your bachelor's, that's a whole nother story because those are universities. And with universities, you paying anywhere from 10,000, was it maybe 10 to 20,000 a year? And for your bachelor's, if you don't already have your associates, if you going in and you have to do 4, then you already do the math. It's a little bit harder to break even when you have when you going for your bachelor's or your master's, because graduate school costs way more anyway. So that's probably why I held off so long to get into my master's. But I think I'm gonna, if not start back for my master's at the end of this year, I'm gonna do it at the beginning of next year, 100%. Okay. So hopefully that answered your question, because school is expensive, but if you are in an environment where you could do a community college and just get your 2 year and pass your boards to get your RN, that's probably more beneficial. And then, once you start working, you get more money than what you used to anyway. So just make sure that you put some money to a side and start paying the student loans back, because they're gonna give you, what I think, maybe a 6-month grace period before they bug you about paying your student loans back. And a lot of people don't even want to pay them back. They'll pay the minimum. But right now, I'm almost close to being at the area where I can get them forgiven, because when I'm a nurse for 10 years, I've worked, all of the hospitals I've worked at have been qualified hospitals. So once I'm at that year 10, you think I'm not going to apply for that student loan forgiveness? I am. Hopefully, if it's still out. And then they can take all of that student loan out, and I can keep the rest of my money. Hopefully that answered your question, though. Anybody else have any questions, comments, concerns? Let me know. And if you are looking right now and you haven't subscribed, feel free to do so. I mean, you sitting here watching me run my mouth, so go ahead and do that. And make sure you give me a like. Appreciate those likes. I'm going to try my best to continue to do these lives on a weekly basis on the weekends, because I'm off on the weekends unless I have plans to do something with my husband or my children. So I'm trying to keep up with that, because I did that with my previous channel. So hopefully I can keep this going, because I want to hear from, the audience, whether you're subscribed or not. I want to interact and see if there's something that I can help you with. Because sometimes, like I said earlier, people gatekeep and you don't always know about stuff. They only tell you bare minimum. So, why not? Why not share the wealth? Okay. Daniel Hush, you said if I was your nurse, you thought you died and went to heaven. Well, thank you, I guess. Okay. Anybody else? Okay, I'm going to tell y'all that quick story about me feeling underappreciated. So when I worked at a local hospital, I worked there and I was, have you worked with anyone from Canada? Yes, I have. Z, I have. Thinking about traveling for work, asking because I live. Okay, so are you trying to be a travel nurse? I mean, yeah, you can travel. Or are you talking about just traveling from Canada into the U.S.? Because I've worked with Canadians when I was in a staff position. If I did when I was a travel nurse, I mean, I'm cool with everybody, so it don't bother me. I don't think I've worked with anybody else. Oh, there's my little one. I don't think I've worked with anybody else that have been out of the U.S. other than Canadians, unless they just didn't say anything. But yeah, so let me tell you this quick story before this girl come bombard this live. So I felt underappreciated when I was at a local hospital. I actually worked with this hospital brand for, let me see, for 4 years. And hold on, little one, hey Puddin', go in my room and watch TV, okay? What? Not right now. I'm still doing my video. I'll be there soon. You want to say hi to everybody and then you can go up? Come on, let's make a quick appearance. Look, you see yourself right there. Now look there and say hi.
Hi.
Okay, go upstairs. I'll be with you shortly, okay? Okay? You want to take your graduation balloons with you?
Yes.
Okay. Make sure they don't get squished in the door. There you go. I'll be up there soon. Okay, let me get back to it. Miss Fatima said hi. Somebody named Fatima. Miss Fatima said hi, lovely. Go upstairs though, okay? But yeah, I felt like I wasn't valued because I was with this hospital for 4 years, and I worked. I mean, my boss seemed like she was pretty cool. I worked with her if she needed me to do anything, and at this time I was working at outpatient clinics, but I was doing the patient education and making sure that the clinic ran smoothly. The doctors did what they had to do, come out of the room, the patients were discharged, I explained what was needed, and then I followed up with them as the weeks went past. So there was another nurse that started, and she kind of was trying to beat the system because for me, I had a company laptop. She was trying to use my company laptop to work from home because her child was sick. Her child was a year older than my little one that was just on this live. But again, that was some time back. So she would make excuses to try to see if she could work from home. And when I told my manager about it, I'm like, hey, I think she's trying to get over on you. I'm just telling you because, I want to be upfront with you, but I think she's just trying to play it and she wants to work from home. So, I told the boss, she heard me, but she kind of didn't. And when this young lady was working from home, she wasn't completely doing her job because in the area where she didn't get my laptop, by the way, not my work laptop. She had to sign out her own because if something was to happen to that, it would have been on me. Excuse me. So I was like, nope, you need to reach out to them and get your own laptop because I don't want something to happen and then it's my fault and then I have to pay for something. Not to be like that, but it is what it is. So when I told my boss about how she was kind of being a little trying to beat the system and she kind of didn't want to hear me, sometimes people hear what they want to hear, but some managers want to keep their staff, whether they're working efficiently or not. So, what happened was when she was working from home, this young lady had me faxing her stuff that she was supposed to fax. I even said, look, let me show you how to e-fax. She was like, oh, I didn't think that I was bothering you. Don't do that because I have my own stuff to deal with and I was taking care of all of this before you even got here. But when you got here, now I'm doing your workload and you're sitting home getting paid because you can't, I'm sorry, whatever that is on my back, because you can't complete your task at home. It wasn't fair because she would put that out there. Oh, she have a little one, but I'm like, my youngest daughter was younger than her, and my older two wasn't even old enough to drive. So, one thing I'll tell you is when I have a job to do, I get it done. There's no excuses. I make do or whatever I gotta do. My husband and I both work in healthcare, and I never made excuses. So the boss would just continue to let her do certain stuff, and it was adding more on my plate, and I felt like she wasn't listening to me. So when it was that time where I was like, okay, I'm getting fed up, I just need to, get out of here. And then traveling came around, and guess what I did? I put in my time, and I went to travel. And my first travel assignment was literally 7 minutes up the street from my house. It was closer than my actual staff job. So, I mean, it is what it is. You can't. What I will tell you in nursing is, and this is probably in any job, you will feel undervalued and unappreciated if you're with the wrong department, the wrong environment. You have to get somewhere where you feel like you're making a difference and that you are heard. When you're not heard, you're not going to want to stay. I mean, comment below out of these people that's watching. If you're not heard in a job, what are you going to do? Are you going to stay there after you've said multiple times to your manager what's going on and nothing has changed? Will you continue to stay there, or will you look for something else? Maybe it's just me because I know I have a license and I can work wherever I choose in Michigan. I also have a license in Ohio too. But I'm just saying, I need some comments in here. If you're undervalued, if you feel undervalued and you talking to your manager about things and nothing has changed and it's continuing to give you more work on top of what you're doing, would you stay in that role or would you look somewhere else? I need y'all to say stay in the role or poof, be gone. I need y'all to engage with me. I know y'all looking. I know y'all can tell me. I'm not going to judge you if you stay, because I stayed there a little bit, but it continued to keep going. And I wasn't getting any more money to do her part. I might as well have done the job by myself. But like I said, I felt underappreciated. So let me know what you would do. Would you stay in that role, or would you leave and get something else? Anybody else have comments, questions, concerns? And I hope I've answered everything that was in the chats. And I hope I'm getting my likes from the video. I appreciate you guys for listening to me. Because I probably won't be on the live forever, because the little one is up. So I'm sure she's going to come back down and ask me for a snack. If y'all have kids and it's the summertime and they out of school, you know you're going to get snacked to death. Can I have a snack? Can I have this? Can I have that? So I'm sure she's going to interrupt and come down and ask for something, because she just got up from a nap that I made her take so that I could do this video without interruptions. Y'all mean to tell me none of y'all will respond to would you stay or would you go if you felt undervalued in a job? I know y'all heard it. I know y'all not that shy. You said, why be a nurse? You should be a model. I actually tried to be a model back when, because I was a lot smaller. And then I actually was going to do some modeling with my older daughters, because we're all tall. So my two older daughters are about 6 feet now. But I am 5'10", and we all small frames. So as you get older, you pick up weight, but we all are like on a smaller frame. So when I reached out to get us in modeling, they wanted us to pay $500 each. And that was about maybe 15 years ago. I'm like, No, back then I didn't have the money to pay $1,500 to possibly get us set up for modeling. So, NT, thank you, but nope, it didn't work for me. All right, Sharon B. Hi, different topic. I have a room for rent for a traveling nurse in Tucson, Arizona. How do I reach out? I mean, how do I reach the nurses to let them know? Okay, Sharon, what you need to do is you need to get on Furnished Finder. Here, let me type it in the chat. Sharon, go to Furnish Finder, or you can list your room in, or you list your room on Airbnb. To be honest, as a traveler, typo. Um, as a traveler, what I did was I rented my living loft. It was a one bedroom. It was a one bedroom loft. I rented that out on Airbnb, and Airbnb actually was cheaper than Furnish Finder for me. With Furnish Finder, you can rent out your room for the month, and you can tell you communicate with the travelers or whatever, but they can rent it out for the entire month. So that can help you. But with Airbnb, they can rent it out by the day. So if you want them to rent out a minimum of 2 days or something like that, you can kind of word it like that. But those two I would recommend: Furnish Finder or Airbnb. You can do like little local type of ads, but I'm not 100% sure if travel nurses look in other places like that. Sometimes you can rent. And tell me, Sharon, how much are you trying to rent your room out for, and what does it include? You welcome. Um, Mr. Hernandez, or is it Mr. Jero? Get out of that job ASAP. Thank you for commenting that. You are the only one that has commented what you would do, and I appreciate that because I know I'm not the only one. Undervalue, you're not gonna stay forever because you're gonna go into that job dreading and dreading being there. So why stay in an environment where you want to be there for the patients or customers or wherever area you're in? You want to be there for them. But if you're undervalued, underappreciated, no, I'm good. Okay. Lemon J. Okay, I stay at my job 33 years, underappreciated and overworked. Others did almost nothing, and any comments by me about my staff was completely ignored. Wow. You just kept my head down and prayed a lot. I understand. What did you do, Jay Lemon? What did you do for those 33 years? Allie, hi. Uh, can I subscribe to your channel? Of course you can. Hopefully it's a subscribe button somewhere. You are my angel for real today. Oh, for the day. Awesome. Well, Allie, welcome. I believe if you're looking on your phone, it should be something in the corner to subscribe. But if you're looking on like a laptop, all of my videos have the little pink subscribe button in the right corner, and you can just click on it. Yes. Told you she interrupting us. Oh, you gotta. Okay, so we got the sound. We got the sound bar on. So on the remote, you gotta hit mute. Hit mute on the remote, and then it won't talk double.
What is mute?
You give me the remote. I'll show you. Bring it down. Okay. Public health nurse. Okay. 22 years. Thank you for your service. Let me see. Well, was the job beneficial at all? I mean, for you to go through underappreciated and overworked for 22 years. I hope you didn't go through that the whole 22 years. I mean, if so, it is what it is. But hold on 1 second, y'all. Daddy get off in a couple hours, okay? So look, this is the mute button. So right here, when you go upstairs, click that, and then it'll cut off the echo. Because we got a sound bar on. So that's why you only watch TV down here, because you don't know how to do our sound.
Okay, I'll see it out here.
You got to wait until I'm done so it won't echo. Okay. Let me go back. Sharon B. It's actually a house share. Room with private bathroom, use kitchen, laundry, den, patio, $600 a month or $175 a week, includes utilities, will also rent by the day. Okay. Yep, definitely use Furnish Finder, Sharon, or Airbnb, because both of those are on those platforms. So if it's a traveler that's coming in that area, that would help. And the prices are pretty good. So that will be good. Either one of those. And let me know if it works for you. I wouldn't say one or the other. I would try both. I don't know if it's a deposit for either of them, because the only space that I use, I mean, the only platform that I use for renting like a loft space is Peerspace, and that's because of our photography studio. Okay. Hello, I started an accelerated RN program and accelerated program in September. Do you have any tips? How should I work while in school? Okay, Queen Serena. How should you work in school? So it depends on your school schedule. For me, I saw that my schedule consisted of day shift. So early on, I knew that I couldn't be the senior lab assistant, because when I did senior lab assistant, I worked early, like 2 a.m. to 10:30 a.m. So I worked, I guess you could say, midnights, because it was 2 a.m. when I started. But also, my classes started at about 8 o'clock. So they wouldn't work with my schedule. So what I did was, even though I was within the lab, I started driving around getting the blood that other phlebotomists drew instead of me drawing the blood. So you have to kind of look and see what your schedule is. It was some people that worked midnights, and I mean, they will be just really tired, which I don't really recommend you working full-time midnights, because you're not going to pass school working full-time. How you going to study? Unless you have like a good weekend job where you could do certain stuff and get your hours on the weekend, and maybe in between your classes, because the first semester is going to be the toughest, because you're trying to learn your nurse judgment, and you have to juggle a schedule. You have to learn differently. You have to work as a nurse in your mind before you even get to clinicals. So you need to look and see what the schedule is going to be your first semester. And if your job is willing to work with your schedule, perfect. If not, you may have to get a part-time job, because my job was part-time when I worked in the when I was a lab courier driving around. I worked part-time because I needed my insurance for my children as well as myself, and I needed an income. I could not work at all, because back then I was a single mom. Okay. Let me go back. I'm missing some comments. Chris Girl 30, she is speaking the truth. I almost left my job 2 weeks ago. Okay. We were able to work it out. Well, that's good. But they really was testing me and was trying to get me to do extras. Absolutely not. You know what? I say it all the time. I don't say it on my channel, but I say it all the time at home. Absolutely not. We're not doing that. Because the extras, some people, oh, well, you're so sweet. Can you help me and do this? But nobody else is doing extras. And you're not getting extra bonuses, are you? Probably not. But as long as they worked it out, perfect. But you got to have boundaries. Not, nope, you're not going to cross that boundary. If you want me to do this, I'm not getting paid anymore. Is it so-and-so doing this too? Don't put all of that extra work on a good worker, because sometimes that extra work on somebody is going to get them out the door, going to another job. Tell me if I'm wrong. Okay. In a nutshell, I was approved for a vacation. Then later on, due to me lacking 12 hours PTO, the two nurses recently quitting, they denied my vacation. What? um so if you was approved and then you were denied, that happened to my husband once. That happened to my husband. He was approved and then denied. Like, don't do that. Don't do that. Why you gonna approve me then deny me? Because of something that had to do with them, not me. You was already approved. You already paid for that vacation. Okay, anyway. Keep your nurses happy and listen to them, and they will stay. 100%, Chris girl. 100%. You have to listen. Because, I mean, my boss back then, she had a good squad. And I don't know, I mean, all of the people that worked hard was sisters. And, you know, it was a couple of lackadaisical people that wasn't a sister that stayed around because she allowed it. But you should have everybody working good, working hard, regardless if you a sister or not. And once I saw that that wasn't working in my favor, where she was throwing somebody else's work or allowing somebody to throw their work on me, I was like, oh no. After I told you about it, and I don't never come to you about any issues, oh no, that's it for me. Thanks. Had to be up out of there. Okay, let me see what else I got. My house is also walking distance from shopping and restaurants, movie theaters, banks, and on the bus line. You are wonderful. Thank you. You're welcome, Sharon. Those are actually good things. If you're close to a hospital, that's even better, because you can kind of put that in your description. Or what you can do is put in your description the distance in miles from the local hospitals in that area. Because if you want to reach out to travel nurses are not going to want to drive a long distance from, whether it's a hotel, whether if it's a room that they're renting, or if it's a house that they're renting. They want to keep the distance to a minimal, but they will drive a little bit of distance if the price is right. So if you're giving them a discount from the other areas, and do your research on how much. If you're the furthest from these hospitals and you're paying and you're charging more, they're not gonna come to you. So do your research. Okay. 33 years, Jalen, 33 years, multiple departments and multiple shifts. It didn't matter because whatever was going on, certain staff were covering for others. Gotcha. Rava Candles. Is life in America easy for you? I've only been in America, so I don't know if it's particularly easy, but it's something that I'm used to. I don't know if that's answering your question or not. I don't know if it's in compared to somewhere else, but I'm an American. I've been here all my life, so I wouldn't say that it's easy. You got to work hard for what you have. Unless you a trust fund baby and you got somebody that just shells you out money, which I'm not. Okay, hi. I am, what is it? Lesso, I believe. TT Diaries. Anybody else have any comments, questions, concerns that they want to share with me? And hopefully, if you're not subscribed to the channel, you are now. Okay, Leslie. Oh, okay, it was a typo. Okay, hi, I'm Leslie. I would like to ask if you think there are more job opportunities as a travel nurse. Well, what I'll say is the opportunities. Thank you, Chris Girl, for subscribing. The opportunities for travel nurse is not as much as it used to. In the height of the pandemic, it was travel nurse jobs through the wazoo. But travel nursing has been around for decades. So it depends on if you're trying to travel to the state for the money, for a better income. If you have, say, your compact license, my state is not compact. Michigan is not. Hopefully they'll get with it. But say you live in Ohio, because I know Ohio is now compact, and you pay for the $100 endorsement, and you travel to every compact state, you don't have to worry about paying for another license. You have that endorsement. So you can go and work at any compact state and get the coin, right? With travel nursing, it's always going to be there. It's not going to be a plethora, say, Leslie, say you live in, let's say you live in Missouri or something. Or let's say you live in Maine. It's no guarantee that you are going to have a lot of travel nurse assignments in Maine now, since the pandemic is no longer like at the height. It's still jobs that are short staffed, only because the seasoned nurses either quit, they got a work from home job, they started working as nurse entrepreneurs and they no longer work the bedside, and they may just have a per diem job. So it's a lot of nurses that's still here. It's just a lot of them that don't work the bedside. So you're going to have travel nurse assignments. It may not always be a lot of them right now, but it will be some. It's multiple ones in Michigan, but it's different specialties. So like I said, I'm in Michigan. So it's different specialties. So if I want to go to the ER, it's several in the ER for me. But the ones that I've seen are like $2,200, right? And those are ones that are local. So for me, that's all taxed. I'm not working a $2,200 contract because it's going to be all taxed. So they're going to tax all of that. So I may get $1,700 a week, which is still pretty decent compared to staff. But you go through way too much hassle to get that low of an amount. And you'll understand this when you work as a travel nurse. It may sound like you being bougie or uptight when you say, I'm not working for under $2,000 take home, because when you go to these travel assignments, I've showed y'all a few in my shorts, they get thrown into some BS. So you're not getting paid bare minimum to work BS jobs. You could do that working for staff if you prefer it. But it's no way that you should be getting less than $2,000 take home as a travel nurse. Okay. Let me see. But it's definitely job opportunities. I would say right now it's more staff jobs than travel. But I haven't looked in every state. I only look in my state. And even though I'm not even on a travel assignment, I get people message me or email me or call me on a daily basis. And they reach out to me for different specialties that I'm not even qualified to work, but they looked at my resume before and they reaching out for ICU. I haven't worked at ICU in about 7 years. 6 or 7 years. No, I don't qualify for that. So do your research. But I believe that it's more hospitals that need help in your local area. But if you're willing to travel, it's plenty of travel assignments. Plenty. It just depends on what specialty that you're trying to get into to travel with. Okay. Toya Clark. Hey there, girl. Keep doing what you're doing. Fellow nurse here. I love your content. Thank you, Toya. I appreciate that. I love when other nurses come on here because I know that we can relate on some things. And not saying that anybody else can't relate, but I know that like just being a nurse, you understand. Just like what was the other young lady that worked for 33 years? Or I'm sorry, the other person, because Lemon J, I don't know if that's male or female, but 33 years as a public health nurse. Big ups to you. Okay. Let me see. Queen Serena. Would you recommend taking a contract at a hospital in exchange for tuition? 1 year for 7,000 per semester. Um, this happens a lot. So wait a minute. Hospital exchange for tuition. To work 1 year and you get 7,000 per. Okay, so you got to actually look at the stipulations. I like to play with these rings for whatever reason. um, but you got to look at the stipulations to that because it may say 1 year of work and you get 7,000 per semester. Of course, you have to be full time. Um, Sometimes you have to stay with the hospital so many years after. So make sure you get that so many years after you've gotten that tuition money. Because with the current job that I'm at, they'll pay for my master's after I'm a year in, but I have to work for them for an extra I think 2 to 3 years. So when they paying stuff, they want stuff in return. So you just gotta, if it's something that you have to deal with and they getting on your nerves and they didn't pay for your schooling, it's like you gotta suck it up, buttercup, and still work with them when they're done. I mean, for the remainder of that time frame, or they're gonna want you to pay back that tuition money. Okay. Queen Serena, you must work full time when you're there when they need you, and I can't pick up the shift. Okay, so Queen, was there anything extra that they were saying like you got to be there, you work full time, but did they say you got to work full time for so many years after they pay for your tuition? Because usually it's some red tape with that. So after a year, yes, they'll pay for your tuition, but after your tuition is paid and you're graduated, what's the time frame you got to stay with them? If you don't know that, look into it, because guaranteed they're going to want you to stay after they didn't pay your tuition. Okay. That one is better than mine. They only gave up to 4K. I'm right. Read that contract. Yep, 100%. Read that contract, because if they do something to where you need to leave, or say something happens and you need to move out of state, or if you, I don't know, got injured on the job and you can't work, you hush, Puddin' Pie. I'll be off here in a few. Talking about I'm taking too long. You hear these kids up in here? And she closed my door. Her. Did y'all hear that? She'll drink. You gotta love them. Okay, but anyway, so read into that contract, whether they're giving you 4,000, 7,000, 10,000. They gonna want you to stay with them a little bit longer than just when they pay you. Is guaranteed. So look into that. Is 42,000 for the tuition. Okay. Queen. If you don't know now, look it up. Because once they start paying, you stuck. And what people try to do is they kind of scare you, because the job that I'm at, even though they'll pay for you to get your nursing master's degree, whether it's your NP or you get your education in nursing, or they won't pay for an MBA, because I thought about getting an MBA, but it has to be something in nursing. So they try to scare you a little bit, because they say, well, you have to make sure you pass boards, and this is like for the techs that want to get into school to be an RN. So if they don't pass the NCLEX after, was it 2 tries, then they have to pay all the money back. It's like, at least they're being realistic. But they paying all this money because they want you to work for them. So whenever somebody is paying for your tuition, you do your research. Some cases, it's better for you to just get the grants and the scholarships yourself, because if something happens to where you don't pass the first time, and you have to retake a class, you know, they may not cover that additional class. Not saying that it'll happen, but realistically, you have to make sure that you cover all little areas. Nobody is perfect. You know, you may not go through nursing school and pass everything the first time, or you may go through nursing school and not pass the NCLEX the first time. You got to see all of the red tape, because $42,000 for tuition, that is probably for a bachelor's. And yes. Uh-oh. Did it freeze? Hold on. I don't know if it froze. If y'all can hear me, let me know. I think it froze. Oh my God. Oh no. Allie, you said yes. Oh. Queen Serene is not a bachelor's. Okay, so I'm gonna just say this and then I'm gonna end it, because my phone is probably about to tuck her out. But it froze. It was only an echo because I cut my audio on my laptop to hear if y'all can still hear me. But $42,000 for tuition is a lot of money. Where is this located? And it's not a bachelor. Is it a master's? Let's see. Let me see if I can unfreeze my phone. Oh, guys. I don't know if I could get it. It's an RN diploma. That's entirely too much. It's an RN diploma. Yeah, that's too much. Let me see if I can take this phone off and switch it. Oh, I'm holding it now. Okay. So, that's a lot. That's a whole lot. Maybe for 16 months. So this is probably a school that's, I think you mentioned it was accelerated, right? So this is probably a school that's accelerated, because if it's 16 months for RN, it took me 24. This is probably one of those commercial schools where you online and they're talking about, oh, get this done in X amount of months or whatever. And it's an arm and a leg. That's a little bit expensive for you to just get a regular RN without your bachelor's. Queen, I would definitely say do your research for something else. Not trying to be sounding like that, but that's not a bachelor's nor a master's. And let me see if I can hold this like that without freezing. I'm gonna just hold it. That's a bit much. That's a bit much. Do your research for something more cost efficient, because you don't want to go into nursing with this huge bill. Yes, Chris Girl, make sure they are accredited, because no. Okay, let me put this on here. I still got some people sending Uh-oh. Come on, phone. Don't act up. Let me scoot this back up. I got a little bit of percentage left on this phone. Okay, I'm back though. All right, let me see. So you was gonna take some classes through Portage Online so it could be cheaper. Okay. I would just say, Queen, do your research on a whole nother school, because that school is entirely too expensive for it not to be a bachelor's. What state is this in? Not to be too much into your business, but is this in the United States? Because that's highway robbery to be 42,000. Just because the job is gonna pay for it does not mean that you need to get into that school. And if it's not accredited, that's a waste. And they just taking your money. Okay. Bear FX. I am a medical laboratory technologist. I am maybe technologist. I need a job. Okay. Where was your last job at? Did you work at a hospital? They hire medical lab technologists in hospitals. Wait a minute. I'm going to take some classes there. PA, they just started it 2 years ago. No. Queen, no. I'm glad I was able to get this live back working, because I did not want to miss this. No, they just started it 2 years ago. Sometimes accreditations take a while. I would not be scammed by that $42,000 school. Check the accreditation, as well as, wait a minute, Everett Institute. Chris, girl, we're going to talk about that, because I know somebody that went to Everett. We used to always have Everett commercials on in Michigan. Oh my God. So no, Queen, you need to look for a brick and mortar nursing school that has been around, that is accredited, that has been around for some years. Okay, with me in Michigan, I went to Wayne County Community College. The college is so old that my aunt, that has been a nurse for over 40 plus years, went there. You need a school like that. You want your foundation at a brick and mortar. When you want to get your bachelor's and your master's, you could do the online stuff. But for your foundation for RN, you need to go to a brick and mortar school that's been there for some time, that is accredited. Because some jobs are going to want your transcripts. And if you go to a school that's not accredited, that 42,000 is going to be a waste of time. Period. Okay. Chris girl, testimony. I went to Everett Institute and they were a scam. Obama and men closed them up and the degree was virtually worthless. I spent 8 months working on that degree in the as a medical assistant. I almost went to Everett. They had an LPN program, but that LPN program was an arm and a leg. I don't remember what it was, but my behind went to a community college, and I end up, I've been a nurse ever since. So no problems at all. Okay. Bear FX. Yes, I worked at a hospital in Africa, but I need a job anywhere available. Well, I don't know about jobs in Africa because I'm in the US, but you just do a simple search. Hi, MNH. Do a simple search. And I'm sorry, I missed out Bill. Hello from Greece. Okay, Bill. Do a simple search on whatever area you want to be in. Google is everywhere, I'm sure, hopefully. Do a search for your medical lab technologist. I'm sure you have experience because you work somewhere else. Doctor up your resume to show that you've worked somewhere, and just start applying wherever you decide to go. All right, Queen, we definitely support you. God will make a way for you. He put this amazing RN on here for you to get information you need. Yes. Queen, we want the best for you, and we don't want you to be scammed. We don't want you to have all of this money. Even though the hospital is going to pay for it, you're going to be attached to them, and hopefully this school is even accredited. So I would do your research to go somewhere else. 100%. It's something is not right. It don't sit right for me, and probably Chris girl is saying the same thing. Don't get scammed, because that's a lot for a RN diploma. That's a lot. Okay. Okay, amen. I appreciate that, Chris. God bless you. See, Queen, we got you. Oh yeah, I did say Eminem. My bad, MNH. I'm just trying to be quick because my phone is about to die. I'm on my iPhone, and it already had paused, and I'm like, oh my God, let me just I was trying to figure out what was going on with Queen because I wanted to help. So my bad, MNH. Okay. God will bless you so much. You are striving to become one of the greatest helpers, especially since you're willing to pay that much for school. Exactly. You can get something at a lower cost. You absolutely can. And you know what? Sometimes you have to sit back and do your research on multiple schools. Because if this school opened 2 years ago, you need to check their accreditation. You need to check with your employer to see if they'll take this school, because some places are funny, okay? They'll take your money and they'll close down in the middle of it. And while this hospital was paying for you, if they close down, that hospital gonna want their money back. And I don't want you to be in that predicament. So I would look at other schools in PA. Okay. You don't have to work for them, but you definitely will do your research. Okay. Okay, good. No, you will get to be an RN. Absolutely. Let me see. All right. None. Make sure you look at, what is it? Atrion? The first time NCLEX passing rates for the school. Yes, that's good. That is good. So, Queen, look at what is being said right here. You want to look at the passing rates for the NCLEX on the first time and the accreditation of the school. And you can Google search this stuff. It's there for you. But a lot of schools thrive at, oh, well, our students are 90% or 95% or 98% passing boards on the first time. They thrive on that. So when you see that, that means that they showed those students the right thing. So when it was test taking time, they were more than enough. They were more than qualified and ready to test. But that's important. That's 100% important. No one speaking some facts right there. Anybody else want to say anything? That's what they said. Laugh out loud. Who said? Queen, who said what? Oh, this stomach looking like it need to be. I'm about to get back to jumping rope because this stomach look extra bloated. Extra. Anyway, we are worst critics. I know. I'm okay. I'm not the extra skinny girl no more with the flat stomach. Days is gone. Anyway, while y'all listening to me ramble, hopefully y'all giving me some thumbs up. It looks like I got 14 of them, so I appreciate that. But anybody else want to say anything before my phone dies? I'm giving you all of my battery life in my cell phone to finish this. As well as my child upstairs talking about I'm taking too long. Oh, okay. The school said that everybody passed the first time. Okay. Well, that's good if they're saying that everybody passed the first time, but look for their accreditation. What are they accredited in? Even if you call, You can call and say, hey, can you give me your your information on accreditation? If they say we're in the process, no, they're not doing it, because there are schools that have lost accreditation and it takes time to get it back, and then there are new schools that's not even accredited. So some jobs won't even take you, like, especially say if you want to work for like the government, like a VA hospital. They really look at your transcripts and they really look at these hospitals, and if that ain't it for them, they'll say, unfortunately we can't hire you, because, and sometimes they won't even tell you, but your school isn't accredited, so we can't hire you at this time. Some jobs just won't call you back. Okay, they said it's 900 clinical hours. Queen, you said 900 clinical hours for what though? Is that what they need for accreditation, or is that just something that they told you that you have to do to pass the class? Anybody else want to chime in and comment? Feel free to do so. If y'all have been watching my shorts, because I know I post a lot of them. I think I'm at 180 something now. I appreciate y'all. I really do, because most of my channel is based off of YouTube shorts than long form. I'm going to get more into my long form. I like to really do the lives, because one subject may not be the same subject for everybody. So I'm on here to talk about multiple things and to hopefully help you to get to your next level, if it's in nursing, or if you're thinking about getting into CNA school and going into LPN school, then going into RN school, or, like the one person said, I want to be a neonatologist and pediatrician. I want to be able to see all of that. I like to interact with all of that, because that's what I'm on this channel for. I'm not on there just to post videos. I want y'all to see, what you say? I want y'all to see the real in healthcare, and to be a helping hand if I can. Let me see. Hello, I'm French. I don't, is it Bim Bim did? Hello. Let me see, Queen. No, during school, there is 2 days of book with the other 2 of clinical, 1 day prerequisites. Okay. So it looks like they have everything planned out. I mean, if not, they wouldn't have been to school, but we just need to know the accreditation for you. Because like Chris Girl said, she was scammed. She wasted 8 months with Everett. I believe, I thought somebody that I know went to Everett for LPN, and he's working as an LPN. He has a channel as well. So I don't know when Everett got shut down, but I believe, I'm not gonna say his name just in case it's incorrect, but I believe he is working as an LPN, an actual agency LPN. So I don't know when they were scamming per se. But yeah, it's terrible. Or maybe, Chris Girl, what are you saying? Like maybe you tried to transfer your credits somewhere else to get the degree in medical assisting and you couldn't? Is that what happened? Probably, it's some schools that, I'm almost done pudding pie. And what I say, a snack time. What you want?
Can I have some mango candy or not?
That was peach. It's not mango. You want some applesauce or something like that?
Give me popcorn.
We're not doing that yet.
You never gave me popcorn.
Well, I gotta get up for that. So what can you grab while I'm still on here, pudding pie?
Like, I could get, let me see, like...
See the interruption? It's okay. Mom life. This, you're not climbing up on my counter for the cabinet. What's in the pantry that you can reach? Eat the applesauce now. I'll be off soon. Okay, so, okay, yes, unfortunate, I'm unable to transfer credits and was able to sit, not able to sit due to revokes. Ah, that's terrible. So I get what you're saying, because I was going to go to a school where I had a full ride. And this was before I even thought about nursing. I was going to have a full ride. Close up my refrigerator. Mama ears. And with this particular school, I won't say their name, they gave me a full ride, but it was a lot of people that were going there, and then after a year they wanted to transfer, and their classes didn't transfer nowhere. It was a total waste for that year because nobody took their credits. So it was a brick and mortar school, but it was just unfortunate. There we go. Have a seat. It was just unfortunate that it happened because you spend all this time with classes and student loans and all of this other stuff for them not to transfer classes? Really? But it is what it is. So Miss Snack Attack is up eating applesauce, and I'm sure I need to take the dog out and do my motherly stuff before my husband gets home. So thank you guys so much for being a part of this live. Hopefully I will do something. If I'm not too busy next weekend, I will do another live with you guys. And if you want me to go over anything in particular, you can comment right here, or in the description there is my there's my email, there is my IG handles for my scrub business, as well as my my IG for YouTube. So if you want to DM me on my channels, or email me on my channels. If you want to DM me on my Instagram, you can. But I am going to leave now. But if you want me to reach, if you want me to talk about anything else in particular for the next live, comment in the chat. I'll see it. Or send me a DM or an email. Thank you so much, guys. Y'all be blessed. You're welcome. I appreciate that so much, Queen. All right, take care. Bye-bye.